Hi, I'm Dr. David Hill, and today we're going to talk about treatment for skin rash on a baby. Now, I'm laughing a little bit because we're going to not be talking for a terribly long time. People do entire fellowships on this subject. There are residencies dedicated to people spending years learning how to identify and treat skin rashes on babies. So I got to say, we're probably not going to cover all that material today, but we will talk about some common rashes that babies do get. Now, the most common rash on a newborn has the worst name of anything I've ever heard of in all of medicine. It's called erythema toxicum. Doesn't that sound horrible? Erythema toxicum? It sounds so poisonous. The fact is, erythema toxicum is anything but toxic. They're these little white dots on a newborn's skin that have a little bit of redness around them. They don't tend to stay in one place. If you take a photograph or just put a little mark on the dot, you'll notice that a few hours later it's not there anymore, but there may be some in some other places. They look almost like ant bites. They don't tend to pop, they don't ooze, they just come up and then they disappear. They don't bother the baby, they don't itch. You can feel okay about these. Erythema toxicum exists only to ruin baby pictures. We don't know why babies get it. We do know what's in it. It happens to be a type of blood cell called an eosinophil. They get together and throw a little party, like a little flash mob in the skin, and then they go away. You don't need to worry about this. Now, if you see something that looks like that but has pus, if something comes out of this lesion, some little liquid or pus, that's not erythema toxicum. And one thing that we're seeing more and more of, even in newborns and young infants, is methicillin-resistant Staph aureus skin infections. Now, methicillin-resistant staph tends to cause pustules. They may be pimples, they may be very large, they often require antibiotic therapy, surgical drainage, or both. The hallmark of these infections is redness and pus. As a good rule, anything that releases pus or liquid in the baby's skin is a bad thing and needs to be checked out. The baby's doctor can look at these lesions. He or she can perform a culture to look for viruses or to look for bacteria, and based on his or her experience, they can try and figure out what medication or course of action is going to be best to make that rash go away. So don't blow those things off. Those are serious. Now, the most common rash you're going to see in a baby is, of course, a diaper rash. But even diaper rashes come in tons of flavors. I'm just going to talk about a couple of the biggest because, like I said, we don't have time to do an entire, fellowship in this today. But the two most common are a yeast diaper rash and an allergic reaction or an irritant reaction to the diaper itself. Probably the best way to tell the difference is the location of the redness. Yeast, just like bread mold, likes dark, moist places. Yeast rashes like places where skin comes together and touches, where sweat and fluid collect between the skin folds. So you see a red, beefy, angry-looking rash, often with little red dots around it, right there where skin touches skin in the diaper area. Now, a reaction to the diaper itself may be to a dye, to a color, or some other component of the diaper. That's where skin touches diaper. And in fact, it tends to spare the places where skin touches skin because that's where the diaper is not. Those rashes are best addressed by changing diaper brand, leaving the diaper off some if you can, and using a good barrier cream. Even Vaseline will do the job, at A&D ointment, Aquaphor. There are a bunch of different products out there on the market, and you can pick one. So talking about common rashes in your baby and what we can do about them, I'm Dr. David Hill.